So I wanted to just briefly demonstrate how we treated Katie. And for the restriction in her subtalar joint, you would scoot down just a little bit more. I have her on her stomach, and it was the left heel, so I stabilized the lower leg and captured the heel, the calcaneus, and distracted it for 30 seconds. And then I added transverse plane rotation, which is also called abduction. And at end range just oscillated that 30 times. And then to treat the lower rotation in the pubic bone, I had her on her back. And I took this 2" by 4" by 8" foam.
There you go. Okay.
And I placed it horizontally under the ischium and did that for 2 minutes. And then retested the lower pube, and it was then symmetrical. And she also had normal spring to the left ischium after that treatment. We retested the pubic joint and found that it was still had a downward step going from the left to the right. And for that treatment, I contacted the right pubic bone and I followed the slope, the angle that it lays in, and I compressed it a little bit to get some purchase on it, to get purchase, and then I pushed it superiorly, and I did that for 5 minutes. And that restored symmetry with no longer having a step off. She had restricted mobility in the right ilium when we rotated it posteriorly, which has been corrected. And she, first we treated that with manual contact, rotating it, but the self-treatment works just as effective, and that is for her to hug her knee outside of her shoulder and to maintain that for 2 minutes. And then let's have you on your stomach, please. She also presented with a sacral torsion, and the left lower quadrant of her sacrum was prominent and it didn't have spring mobility, whereas the other quadrants I was able to take up the slack, spring it, and feel a recoil with good mobility, but on the left lower quadrant it didn't move. She also lacked superior glide mobility, and I'll go ahead and demonstrate the treatment for that. So what I did was I had her take a foam roll like this, that's 2" by 4" by 8", and place it across the mid pelvis, so it's across the lower sacrum. And I had her stand against the wall with feet as wide as her shoulder, 4 inches forward. And then I simply had her touch the wall with her shoulder blades and bend forward 30 times, bringing nose in front of toes. And that successfully resolved the rotational element. When we retested her, she then had normal spring mobility on that left lower quadrant. However, she was still inferior on the left ILA, and she lacked superior mobility through the sacrum, whereas on the right side she had good mobility. So we had her scoot over towards me, and then side bent her body to the right. Yes, and we had her turn her head to the right. And then you have to isolate the coccyx, because you certainly don't want to spring on the tailbone. So just make sure you're under that ILA. And we took up the slack and maintained that for 2 minutes. And she described a little click and felt like that reduced pain somewhat. And straighten out again, please. And that restored normal mobility. The coccyx was significantly side bent, so when I come with both index fingers on both sides of it and pull up, the left side had a higher sulcus, a deeper sulcus. And that's because the coccyx has a transverse process on the first segment, and it was side bent this way, so this was deeper. So to reduce that side bending fixation. I put my thumb to isolate the coccyx and captured the sacrospinous ligament on this side. And came in like that, took up the slack on that ligament and a little bit of gluteus muscle and certainly a little bit of the sacrotuberous ligament as well. And I maintained that for 5 minutes. Then I reoriented and came onto the left side of the coccyx and pushed the entire coccyx over to the right very gently times 5 minutes, and that successfully restored symmetry and reduced pain in sitting. Okay? And she had some tightness in the upper cervical. It was moderately tight at first, and it softened in response to that, but there was still a little bit of stiffness there. And so what I did was I had her lie on her back, folded a towel, and placed this under her occiput. So we had her neck in about 5 degrees of flexion. And lift up your head. Very good. Come down on that. And then I contacted her temples with the palms of my hand so that I could do a straight pull towards me, and so that it would decompress circumferentially at the upper cervical spine. And I just did traction just like that. Just pulled very gently until I could see her feet move a little bit. And I maintained that for 5 minutes. And that effectively restored normal muscle tone in the upper cervical and normal mobility. When you do traction, you should see someone's feet bob up and down. And she had moderate movement, and afterwards she had normal mobility. So that's what the treatment consisted of. It's very straightforward, and I thank you.